Today we'll discuss the urethra. Now, firstly, the male urethra. It is about 18 to 20 centimeter long, extending from the internal urethral orifice in the urinary bladder to the external opening at the end of the penis. This is considered in two parts: the relatively long anterior urethra and the posterior urethra. Coming to the long anterior urethra, this is about 16 centimeter long, lying within the perineum and the penis distally, surrounded by corpus spongiosum, and is functionally a conduit. Then we have the shorter posterior urethra, about 4 centimeter long, lying in the pelvis, proximal to the corpus spongiosum and acted upon by the urogenital sphincter mechanisms, and also acting like a conduit. The posterior urethra has three parts: the pre-prostatic part, the prostatic part, and the membranous part. Now, the anterior urethra has a bulbar urethral proximal component that is surrounded by the bulbospongiosus, lying entirely within the perineum. Also, we have the pendulous or the penile component of the anterior part of the urethra continues to the tip of the penis. In the flaccid penis, urethra as a whole represents a double curve except during its passage of fluid along with it. The urethral canal is a mere slit. In the transverse section, the urethral slit is crescentric or transversely arched in the prostatic part. In the pre-prostatic and the membranous part, it is stellate. In the bulbar and the penile portion, it is transverse, and the external urethral orifice is sagittal. Now, why the different shapes in transverse section? Basically, it is to facilitate the passage of urine in a continuous stream, right? Since it is passing under pressure, the stream falls a little away from the body and males can urinate without wetting themselves, right? So this is just the endoscopic view of the urethra. Okay, this is the bladder mucosa over here. You can see the trigone. Then this is the posterior bladder neck with the left lateral lobe of the prostate gland. Next, we can see the urethral crest, the prostatic sinuses, veromontum, and the prostatic utricle. We'll discuss these parts further on, right? Here we can see the membranous urethra, this is the penile urethra and continuation, and this is the navicular fossa. Firstly, let's see the posterior part of the male urethra. The first part is the pre-prostatic part, which is about 1 to 1.5 centimeter in length, extending almost vertically from the bladder neck to the verumontanum, which is the superior part aspect in the prostatic urethra. The pre-prostatic part is surrounded by the proximal urethral sphincter mechanism. Now, what is this proximal urethral sphincter mechanism? Right, so in addition to the smooth muscle bundles which are running in continuity from the bladder neck down to the prostatic urethra, there are some distinct smooth muscle cells within the prostate, and this is surrounding the bladder neck and the preprostatic urethra. They are arranged as distinct circular collar which has its own distinct adrenergic innervation. Now, the bundles which are forming this preprostatic sphincter are smaller in size compared to the muscle bundles of the detrusor muscles and are separated by a relatively large connective tissue component rich in elastic fibers. They are also different from the detrusor muscle in a way that the rest of the urethral smooth muscles of both sexes, the preprostatic sphincter is almost completely devoid of parasympathetic cholinergic nerves, only supplied by the sympathetic nerves. Now, the contraction of this preprostatic urethra serves to prevent retrograde flow of the ejaculate through the proximal urethra into the bladder. It may maintain continence when the external sphincter has been damaged. It is extensively disrupted in vast majority of men that have undergone the bladder neck surgery or the transurethral resection of the prostate gland. So in these sort of patients, the retrograde ejaculation occurs. This mechanism is absent in females, right? Simple mucous glands line the tissue around the preprostatic urethra, surrounded by the preprostatic sphincter, and the simple glands are similar to those in the female urethra and are unlike the glands of the prostate. Now, coming to the prostatic part of the posterior part of the male urethra, this is about 3 to 4 centimeter in length, tunneling through the substance of the prostate closer to the anterior part than the posterior surface of the gland, emerging from the prostate slightly anterior to the apex, the most inferior part. The urethra turns inferiorly as it passes through the prostate, making an angle of about 35 degrees. Throughout its length, the posterior wall has a midline ridge. Can you see over here? This is called the urethral crest. This crest is projecting into the lumen, causing the lumen to appear precentric in transverse section. Here, you can see this part, prostatic urethra. On each side of the crest, we can see shallow depressions. These are called the prostatic sinus. The floor of this prostatic sinus is perforated by orifice of about 15 to 20 prostatic ducts. Now, there is an elevation called the verumontanum. This is verumontanum. That is also called the colliculus seminalis at about the middle of the urethral crest, containing opening of the prostatic utricle and the ejaculatory ducts. Now, like I mentioned, it contains the slit-like orifice of the prostatic utricle. On both sides or just within the orifice are two small openings for the ejaculatory ducts. This is an important diagram. The features of the prostatic part of the urethra are important. Now, what is this prostatic utricle? Now, it is basically a cul-de-sac about 16 millimeter in length, running upward and backward in the substance of the prostate gland behind its median lobe. The walls are composed of fibrous tissue, muscle fibers, and a mucous membrane. The mucous membrane is pitted by small openings by openings of numerous small glands. Very important, developing from the paramesonephric duct or the urogenital sinus and is homologous with the vagina of the female. This is the masculine vagina. It also is another name for the prostatic utricle. The lowermost part of the prostatic urethra is fixed by the puboprostatic ligaments and is therefore immobile. Now, coming to the membranous part of the male urethra, it is about 1.5 centimeter. It is the shortest, least dilatable, with the exception of the external urethral orifice in the narrowest section of the urethra, descending with a slight ventral concavity from the prostate to bulb of the penis, passing through the perineal membrane, which is 2.5 centimeter, posterior inferior to the pubic symphysis. Now, here. So the wall of the membranous urethra over here, or part of the external or the distal urethral sphincter mechanism, this muscle coat is separated from the epithelium by a narrow layer of the fibroelastic connective tissue. The muscle coat consists of relatively thin layer of bundles of smooth muscle cells which are continuous proximally with those of the prostatic urethra and a prominent outer layer of circularly arranged striated muscle fiber called the rhabdosphincter, which is forming the external urethral sphincter. The external urethral sphincter represents points of highest transurethral pressure in the normal and in contracted states. Intrinsic striated muscle is made up of fibers of very small diameter, devoid of muscle spindles, physiologically being slow twitch type, unlike the pelvic floor with heterogeneous mixture of slow and fast twitch type of large diameter. Now, these slow twitch fibers of the sphincters are basically capable of sustained contraction over long period of time, and it contributes to the tone and it closes the urethra while maintaining the urinary continence. So, the different components of the distal urethral sphincter mechanism are the urethral smooth muscle, the urethral striated muscle or the rhabdosphincter, most important component as it is capable of sustained contraction, the pubourethral part of the levator ani, which is important to resist surges of increased abdominal pressure on coughing or any exercise. Now, let's come to the anterior part of the male urethra. The anterior or the spongiosus part lies within the corpus spongiosus muscle, very long, 16 centimeter long when the penis is flaccid. It extends from the membranous urethra to the external urethral orifice on the glans penis. It is starting below the perineal membrane at a point anterior to the lowest part of the pubic symphysis. The part of the anterior urethra which is surrounded by the bulbospongiosus is called the bulbar urethra. The bulbourethral glands in this section are lying 2.5 centimeter below the perineal membrane. From here, the penis is flaccid, urethra curves downward as the penile urethra. It is narrow and slit-like when empty and has a diameter of 6 mm when passing urine. Now, it is dilated at the terminal end within the glans penis, and this dilatation is called the navicular fossa. The external urethral orifice is the narrowest part of the urethra and is sagittally a slit which is about 6 centimeter long bounded on each side by a small labium. Important is the epithelium of the urethra, particularly the bulbar and the distal penile segments, presents with an orifice of numerous glands and follicles situated in the submucous tissue called the urethral glands, contains a number of small pit-like recesses or lacunae of varying sizes. One lacuna is larger than the rest, called the lacuna magna, which is situated on the floor of the navicular fossa. Now, the urethral arteries arising from the internal pudendal artery supplies the glans penis along with the dorsal penile artery via the circumflex branch on each side. Now, the anterior urethral veins drain into the dorsal vein of penis, into the internal pudendal vein, which is running, which is draining into the prostatic venous plexus, then into the internal iliac veins. Now, the posterior part is directly draining into the prostatic and the vesical venous plexus, and then into the internal iliac veins. The prostatic urethra is draining into the internal iliac, the membranous urethra into the internal iliac, and the anterior urethra into the deep inguinal lymph nodes. Now, the prostatic plexus, the nerve supply, supplies the smooth muscle cells of the prostate gland and the prostatic urethra. The parasympathetic nerves are from S2, 3, 4 sacral segments. The greater cavernous nerves are sympathetic to the pre-prostatic sphincter during ejaculation. The nerve supply of the rhabdosphincter is controversial, but is said to be by neurons in Onuf's nucleus situated in the second segment of the spinal cord, fibers of which pass via the perineal branch of the pudendal nerve. Now, we have done in detail regarding the traumatic urethral injuries or the straddle injuries leading to the injury to the penile urethra and the perineum. We have spoken previously regarding the extravasation of urine. Now, it is prevented from going posteriorly as the perineal membrane and the membranous layer of superficial fascia are continuous with the fascia surrounding the superficial transverse perineum. You can see this is the rupture of the membranous part of the urethra, and this is contained within the deep perineal pouch. This is the rupture of the penile part of urethra contained within the superficial perineal pouch, right? Um, Laterally prohibited by the ischiopubic rami, above to the lesser pelvis by the intact perineal membrane. So, the extravasated urine goes anteriorly into the loose connective tissue of the scrotum and the penis and then to the anterior abdominal wall. So, this is about it about the male urethra. Next, we'll do the female urethra.